Calling the intuitive surgical robot a robot is actually a bit of a misnomer, because a robot by definition is something that does something in an automated fashion by itself. The robot we use in the operating room, the Da Vinci intuitive surgical robot, is actually nothing more than a responsive instrument. It does what our hands tell it to do.
The way I would explain robotic surgery is that it's like an F-16 airplane. When a pilot flies that highly complex airplane, it's no longer a string on a stick. As he moves the stick, it is a complex series of moves that happen with a computer that then guides and flies that complicated airplane and weapon system. Likewise, with surgery and the robot, what happens is a surgeon sits separate from the patient at a console, and it allows that surgeon to do far more complicated maneuvers and procedures that he could never do in an open fashion. It also has something called scaled maneuvers, that when we move our fingers 3 to 4 inches, we can scale it to where with the robot it only moves 1 inch. So any imprecision that we may have with our hands is dramatically augmented by the robot, such that it's much more precise. When people watch us operate, it looks as if we're so smooth and just perfect. And because any imperfections that we have as humans can basically be eliminated by the robotic procedure.
And oftentimes we do have patients coming in requesting robotic surgeries, and in our opinion, that's not necessarily the best, most efficient, safest surgery for the patient.
The robot is a tool in the surgeon's arsenal, much like a scalpel or forceps or scissors. It has to be operated by the surgeon. So contrary to what many people think, that the robot does the surgery on its own, it actually takes a skilled surgeon to operate the robot.